Retention of urine is the inability to empty a full bladder. It is the commonest in urological emergencies worldwide. Adult males are more commonly affected, and is rare in children and in females. The causes differ in different age groups as well as in males and females. A family history of retention of urine in benign prostatic hyperplasia, prostate cancer, breast cancer, and ovarian cancer are risk factors. Retention of urine can be classified into three. So the first classification is acute retention of urine, and is of sudden onset with a palpable tender bladder. Second classification is chronic retention of urine. This of insidious onset and presents with a palpable non-tender bladder and overflow incontinence, resulting in more damage to the bladder, ureters, and kidneys. And renal failure may complicate this type of retention with hydronephrosis and hydrouretus. Thirdly, acute on chronic retention of urine is when a chronic retention of urine is suddenly complicated by acute retention of urine. The causes are adult males above 50 years or BPH as benign prostatic hyperplasia, urethral strictures, bladder neck stenosis. Adult males below 50 years or young males free from urethral strictures, urethral injuries, bladder neck stenosis, neurogenic bladder or spinal injury, paraphimosis, urethral calculi, and acute prostatitis. For male children, free from posterior urethral valves, meatal stenosis, and phimosis, urethral calculi, and congenital strictures. And adult females from retroverted gravid uterus, uterine fibroids or myomas, impacted ovarian cysts, neurogenic as postoperative and pelvic inflammatory disease, and carcinoma of cervix with infiltration into the urethra. Symptoms are retention of urine in benign prostatic hyperplasia precipitated by postponement of nutrition, alcohol abuse, and infection. Sudden inability to pass urine with painful bulge in the lower abdomen for acute retention of urine, and gradual onset of inability to pass urine with painless bulge in the lower abdomen for chronic retention of urine. Also, history of urethritis, urethral instrumentation, for example, catheterization of perineal injury, pelvic fracture, or surgery in urethral strictures, and International Prostate Symptom Score as IPSS. Signs that are usually elicited are palpable tender bladder in acute retention of urine, palpable non-tender bladder for chronic retention of urine, uremia or azotemia in renal failure, fever in infections as UTI and prostatitis, palpable kidneys in hydronephrosis, hematuria in benign prostatic hyperplasia, prostate cancer, and urethral strictures. The referral criteria: patients with hydronephrosis on ultrasound scan and renal failure should be referred to a specialist.